Sexuality has always been a problem. It's just that our mothers got married at the ages of 18 and all that, whereas with us, at the age of 18, you should still be in school.
When I have to go to a clinic, you always find people who are still judgmental. So yes, we do have access to the services, but however, the treatment that we get from the services is not really good.
Well, my message today is nurses should be facilitators of services, not barriers.
So if we're saying a lot of the young people are dropping out of school, we are not able to reach them with the formal education system, we are also not able to reach them well when they're out of school.
The campaign is unique because it brings together sexuality, education, and reproductive health.
And we know that the level of condom use among our young people is generally increasing in the region, which is very good and positive when you look at it overall. But the rate is low. Too low and too inconsistent.
We know what young people need. We've heard their voices. They're speaking to us. We're speaking to them. And I believe that together we can respond to these needs and sustain our interaction with young people and provide the services that they need.
And we know that sexuality education does not promote promiscuity. We know that it does not increase the number of sexual partners.
When we consider that most of our young people complete less than 6.5 years of education, we can see that our youth are not getting the opportunity to develop their cognitive and other skills, and therefore they are not able to successfully transition into adulthood.
About 40% of all clients who come to services are young people. That tells us that if the services are available, if the services are quality and the services are friendly to young people, the young people will use them. I also need to prevent pregnancy because that's one way they drop out. And if they become pregnant, we need them to be returned back to school after delivery. Let her come back, and she actually can be a role model for the other girls. She says, what mistake did I make that the others should not be making?
If young people are receiving sexuality education, health should be ready to meet them with the services that they require. We need to align our policies so that health is saying the same language as education.
Young people are sexually active, they need information, they need education.
My message today is talk to us, not at us. Hear us talk about sex.
I urge you guys to see us young people as partners instead of just mere beneficiaries.
Address the needs of young people. Today, with them, and collectively, we can make a major difference in the development of our region.